Do ulcers always need a biopsy? Imagine having a stomach ulcer and wondering if you need a biopsy to find out what's really going on. The truth is, not every ulcer requires one, but in some cases, it's really important. When doctors look inside with an endoscope, they can see the ulcer and sometimes take a small tissue sample. This helps them figure out if the ulcer is caused by bacteria like Helicobacter pylori, medications like NSAIDs, or something more serious like cancer. Biopsies are especially crucial when dealing with gastric ulcers in the stomach. Even if the ulcer looks harmless, there's a small chance it could be cancerous. Studies show that about 2 to 5% of ulcers that appear benign on endoscopy turn out to be malignant when biopsied. So, doctors usually recommend taking tissue samples from gastric ulcers to rule out cancer. This is a key part of ensuring the right treatment plan. Biopsies also help determine what caused the ulcer. Knowing if it's linked to Helicobacter pylori infection or NSAID use guides doctors on how to treat it effectively. For example, if Helicobacter pylori is involved, antibiotics can be prescribed to clear the infection. If NSAIDs are the cause, stopping or changing medication might be necessary. Sometimes, even after treatment, ulcers don't heal as expected. In those cases, doctors may suggest repeat endoscopy with biopsies to check if the ulcer has become cancerous or if there's another issue. If an ulcer doesn't improve within 8 to 12 weeks of therapy, it's a good idea to investigate further with biopsies. Now, not all ulcers need a biopsy. Duodenal ulcers, which are in the upper part of the small intestine, often don't requiring biopsies unless they are unusually large, look different, or don't respond to treatment. If an ulcer has healed completely and the cause is clear, routine biopsies might not be necessary. In practice, endoscopy is the main tool for diagnosing ulcers and obtaining tissue samples. It helps doctors see the ulcer directly and decide if a biopsy is needed based on the ulcer's appearance, location, and how it responds to treatment. Remember, each case is unique. The decision to biopsy depends on many factors, including the ulcer's size, shape, and whether it's healing. Always consult with a healthcare professional for personalized advice. They can assess your specific situation and determine if a biopsy is the right step for you. So, while not every ulcer needs a biopsy, in many cases, it's a vital part of making sure you get the correct diagnosis and the best possible care.